Many people operate under the assumption that an absence of pain is proof of perfect health. We often treat the lack of symptoms as a clean bill of health, ignoring the internal processes that tell a different story. This chart maps the progression of chronic illness. Notice the silent period, a biological gap where failures take root before triggering symptoms. High blood pressure, diabetes, and heart disease thrive in this gap, quietly damaging organs for years without external alarm. Waiting for obvious symptoms like chest pain or blurred vision means reacting to a disease that has already established a stronghold. A proactive approach searches for these warning signs through targeted medical investigation. The annual physical exam is designed to pierce the illusion of feeling fine. It serves as a tool to expose hidden conditions while they are still manageable. Verified positive biomarkers provide a more reliable defensive strategy for longevity than the simple absence of pain. The annual checkup confirms that health is an active state, not just a lack of symptoms. The investigation begins in the primary care office with a systemic review of personal and family medical history. This step identifies inherited risks and sets the stage for the physical exam. Next, the physician establishes your biological baseline by extracting vital signs. They measure blood pressure, heart rate, temperature, and respiratory rate to see how the body functions under normal conditions. During the head-to-toe assessment, the doctor evaluates the functionality of the heart, lungs, and abdomen while testing the neurological system for proper responsiveness. Minor anomalies in these surface-level metrics, like a slight wheeze or an elevated resting pulse, signal underlying systemic issues that warrant a closer look. Patients should arrive with a list of current medications and any immediate health concerns to ensure the most accurate baseline readings during the exam. While the physical exam creates a vital structural map of your health, identifying the most elusive threats requires an investigation at the molecular level. Blood testing looks directly at the body's internal chemistry, removing the guesswork by analyzing the fluid that supports every organ. Tests like the complete blood count and the comprehensive metabolic panel evaluate overall organ function, providing a clear view of how well the body is filtering and processing nutrients. This visualization compares protective HDL against harmful LDL cholesterol, acting as the primary indicator for cardiovascular risk, flagging potential issues before plaque buildup. By tracking blood sugar levels through an A1C test, doctors identify prediabetes early, allowing for intervention before permanent insulin resistance takes hold. To ensure the chemistry is measured at its true, uninfluenced baseline, patients must fast for 8 to 12 hours before these specific tests are performed. Lab results transform vague physical feelings into hard data, creating the foundation for a precise medical strategy. This diagram illustrates the convergence phase, where medical history, physical metrics, and lab data merge into a single, comprehensive profile of your biological state. This profile is reinforced by age and gender-appropriate cancer screenings, adding a final layer of defense to the preventative strategy. Using this complete picture, the primary care physician engineers a personalized wellness plan that includes specific recommendations for diet, exercise, and lifestyle improvements. Identifying insulin resistance or hypertension in these early stages allows for a reversal of the condition through lifestyle changes, often removing the need for long-term pharmaceutical intervention. Most insurance plans, including Medicare and Medicaid, cover these annual preventative exams at no cost to the patient. Paradise Medical Center Primary Care, located at 8380 Southwest 8th Street in Westchester, Miami, provides the thorough analysis and care needed to manage these health milestones. Scheduling an annual physical transitions you from a state of anxious reaction to a position of proactive command over your health and your future.